Life is returning to normal here in the United States finally, but health experts are still concerned about contagious and harmful COVID-19 variants spreading around the world.
And KMBC9's Matt Pritchard is in Washington with a look at what has doctors worried.
The Delta variant is one of the biggest concerns right now, but even so, it's hard to dampen the optimism that's rolling out across the country.
What we're seeing is a truly American accomplishment.
President Biden touting vaccination totals.
We've gotten 300 million shots in the arms of Americans in 150 days.
65% of U.S. adults have at least one dose of a COVID-19 vaccine, with dramatic drops in hospitalizations, deaths, and most notably case totals.
We've seen a 95% decline in just the past 5 months.
While those figures are encouraging, areas of concern still exist.
It's spreading so fast. It's one of those who are highly contagious.
Cases of the Delta variant are growing by the day, and for those who haven't gotten their shot yet,
unfortunately, it will lead to infection, hospitalization, and mortality.
Which is why the main message hasn't changed as officials travel the country encouraging people to get their shot.
The vaccines are safe, and they are free, and they are effective.
In Washington, Matt Pritchard, KMBC 9 News.
Here in the United States, nearly 148 million people are fully vaccinated against COVID-19.
Tonight, we know the COVID-19 Delta variant, first identified in India, now accounts for 99% of new coronavirus cases in the United Kingdom. More than 33,000 cases of the Delta variant have been diagnosed this week alone. Now, the new data suggests both the Oxford, AstraZeneca, and Pfizer's coronavirus vaccines are about 75% effective in preventing hospitalization from the variant after a single dose. It all goes up to 94% after 2 doses. Now, common symptoms for the Delta variant are a headache, sore throat, and runny nose. Researchers are also seeing cases where people lose smell or taste. Now, even if the symptoms aren't severe, patients are contagious and it can put others at risk.
Doctors at the University of Kansas Hospital are responding after the CDC said it's investigating more than 300 cases of heart inflammation following COVID-19 vaccines in young people. The Advisory Committee on Immunization Practices will meet next week to review those cases. Right now, it's unclear whether or not vaccines are the cause. Doctors here say it's no reason for alarm.
Doesn't seem too concerning, very rare. This should in no way prevent you from getting your children 12 and above vaccinated. Again, my children have been vaccinated. My daughter's 12, my son is 14. Very safe overall, and it is going to help protect them against the risk of that multi-system inflammatory disease, of that risk of hospitalization.
Dr. Hawkinson says his children are doing well after their shots. They both got their second dose of the vaccine last Thursday and had a weekend full of activities with no problem.